Obsessive compulsive disorder is a common, chronic and long-lasting disorder in which a person has uncontrollable, recurring thoughts or obsessions and/or behaviors and compulsions that he or she feels the urge to repeat over and over. The obsessions often have themes to them, such as a fear of contamination or dirt, doubting and having difficulty tolerating uncertainty, needing things orderly and symmetrical, aggressive or horrific thoughts about losing control or harming yourself or others, unwanted thoughts including aggression or sexual or religious subjects. Examples of obsessive signs and symptoms can include fear of being contaminated by touching objects that others have touched, doubts that you've locked the door or turned off the stove, intense stress when objects aren't orderly or facing a certain way, images of driving your car into a crowd of people, thoughts about shouting obscenities or acting inappropriately in public, unpleasant sexual images, avoidance of a situation that can trigger obsessions such as shaking hands. Factors that may increase the risk of developing or triggering obsessive-compulsive disorders can include a family history. Having parents or other family members with the disorder can increase your risk of developing OCD. Stressful life events. If you've experienced traumatic or stressful events, your risk may increase. This reaction may, for some reason, trigger the intrusive thoughts, rituals, and emotional distress characteristic of OCD. Or other mental health disorders. OCD may be related to other mental health disorders like anxiety disorders, depression, substance abuse, or tic disorders. Glutathione is known as the body's master antioxidant and it has many functions. Several lines of evidence support the hypothesis that lower cerebral levels of glutathione are associated with increased oxidative stress, and this may contribute to obsessive-compulsive disorder. Numerous factors can reduce your glutathione levels, such as deficiencies like selenium, or a depletion due to a toxic load such as mercury poisoning from mercury amalgam tooth fillings. Some ways to increase your glutathione are with reduced glutathione at doses of up to 1000 mg per day. N-acetylcysteine, which is the glutathione precursor, at doses of 500 mg 3 times per day. The herb milk thistle, and also ensuring that you get enough selenium, for example by consuming 3 Brazil nuts per day. A vitamin B12 deficiency is a commonly overlooked cause of psychiatric and even some neurological illnesses. Common neuropsychiatric illnesses associated with a B12 deficiency are dementia, neuropathies, depression, and irritability. Authors conclude that OCD was an early manifestation of a B12 deficiency. You should take B12 in the form of methylcobalamin in an oral sublingual form. Realize that a blood test for B12 may not be accurate, as food is now fortified with folate, and this can give a false reading on the B12 blood test. As B12 is water-soluble, it's generally considered safe when compared to fat-soluble vitamins. B vitamins are essential for creating dopamine, epinephrine, serotonin, and myelin. They also help the mind to focus. They help hemoglobin hold oxygen, and they lower cholesterol. Vitamin B is essential to good health. It's also used for energy production in the human cells. B vitamins help to convert food, often consumed as carbohydrates, into fuel. They also help the nervous system to function properly. Taking a multi-B complex will help to enhance the action of B12. There's cases of psychosis resulting from a thiamine deficiency. Therefore, adding an additional thiamine supplement to this mix of multi-B plus B12 may also be of benefit here. DNA methylation regulates gene expression by recruiting proteins that are involved in gene repression, or by inhibiting the binding of transcription factors to DNA. The precise regulation of DNA methylation is essential for normal cognitive function. It's important to note that any DNA methylation that occurs as a result of stress or some environmental factor could lead to the onset of obsessive compulsive disorder. Therefore, learning more about epigenetic alterations of DNA through DNA methylation is crucial in understanding OCD and anxiety disorders. Undermethylated people tend to have more obsessive compulsive tendencies and controlling behaviours, addictiveness, and they can also be quite aggressive. Severe, unshakable delusions, brain fog, etc. are all typical symptoms of undermethylators. 98% of people on the autism spectrum were tested and were found to be undermethylated. 95% with antisocial personality disorder are undermethylated. 90% with schizoaffective disorder are undermethylated. 85% of people with oppositional defiance are undermethylated. 82% of people with anorexia are undermethylated. And 38% of people with depression are undermethylated. L-methionine, or SAMe, can be used for patients who are undermethylated. A higher L-methionine dose is required than SAMe. Patients also improve with zinc, vitamin C, calcium and magnesium, and vitamin B6. Inositol sometimes helps with sleep problems. Treatment can take months before an improvement is noted. D-L-methionine is much cheaper than SAMe. Also, trimethylglycine from sugar beet provides the same benefits as SAMe at a fraction of the cost. Decreases in homocysteine and MDA suggest a potential role of MSM in supporting metabolic processes that require methylation, such as antioxidant capacity. MSM is an organic sulfur compound, and it can be taken in doses ranging from 5 up to 30 grams per day. Detoxification is to be expected, so start with a small dose and then slowly build up over time. There's many other health benefits attributed to taking MSM. The detoxification symptoms of MSM can be reduced by taking it with vitamin C. You could take that as liposomal vitamin C or non-acidic vitamin C for best results, but not cheap acidic ascorbic acid. Garlic is another sulfurous compound, and it also helps people who are experiencing undermethylation. In a study, 48 patients with obsessive compulsive disorder were compared with 48 healthy controls, and it was found that the serum zinc, iron and magnesium levels had decreased in the patients with OCD. Only food source iron would be recommended, as synthetic iron has now been shown to be bad for health. Zinc, such as 50 mg of zinc picolinate, can have numerous benefits, such as activating enzymes and helping the immune system. Oysters are one of the highest zinc-containing foods. It's the zinc in oysters that get attributed to it having sexual benefits. The best form of magnesium is magnesium bisglycinate. In order to determine your dose, slowly increase until stomach discomfort or diarrhea is noticed. Then gradually reduce the dose until you've determined your maximum tolerable daily dose. As magnesium is required by hundreds of enzymes to properly function, it can have profound benefits after a few months of supplementation. It may also help to balance and reduce the abnormally high levels of calcium, which are often found in patients with obsessive compulsive disorder. Uridine is naturally found in breast milk, but it's now synthetically made. Uridine plays a critical role in pyrimidine metabolism in your brain. In the simplest terms, uridine monophosphate promotes neurons and synapse growth and DNA repair. Benefits reported by users include uplifting and stabilizing of the mood, reducing stress and OCD symptoms, a reduction in anxiety, and modulating and normalizing dopamine levels. Uridine monophosphate is the best form due to its price and the scientific evidence backing it up. Doses can range from anywhere from 150 mg up to 2 grams per day. It works synergistically with omega-3 and choline for the creation of new synapses, improving brain function. Users report an increase in verbal fluency from consuming uridine monophosphate. Theanine is extracted from green tea. L-theanine supports neurocognitive function in several ways, supporting both neurotransmitter function and also brainwave activity, and in the case of OCD, helping to calm the brain. L-theanine modulates aspects of the brain function in humans by increasing alpha brainwave activity, and this calms the brain. Doses can be anywhere from 100 mg up to 1000 mg per day. Oxidative stress describes oxidative damage in a cell. The levels of oxidative stress have been found to be much higher in the fat cells of people with obsessive compulsive disorder than in others. Antioxidants protect cells from the oxidative stress. Vitamin E and vitamin C are both antioxidants. People who are affected by OCD have been shown to be significantly deficient in vitamin E and slightly deficient in vitamin C. You should take a mixed tocopherol food form of vitamin E complex for best results. Valerian officinalis is a well-known medicinal plant with a long history of use for its effect on the GABA receptors. A study that was 8 weeks, double-blind, randomized trial with 31 adult outpatients who met the DSM-4's criteria for obsessive compulsive disorder on the structured clinical interview participated in the trial. In this double-blind and randomized trial, the patients were randomly assigned to receive either capsules of an extract of valerian or placebo for 8 weeks. The results suggested that the valerian officinalis has some anti-obsessive and anti-compulsive effects. 5-HTP or 5-hydroxytryptophan is a naturally occurring amino acid and a chemical precursor, as well as a metabolic intermediate in the biosynthesis of the neurotransmitter serotonin. Clinicians around the globe for more than 20 years have had success with amino acid precursors, including 5-HTP, for the treatment of obsessive compulsive disorder. It's recommended starting all patients with 50 mg of 5-HTP and then to titrate slowly every 2 weeks up to a maximum of 200 mg per day dose. Caution should be taken if 5-HTP is being taken with prescription antidepressants, as there's a potential to have too high a serotonin level. Therefore, medical supervision should be advised if a patient is taking antidepressants. Research examining the ability of CBD to treat OCD is still in the early stages. However, some studies have found evidence that CBD may help to manage symptoms, and that many people anecdotally report that they find it helpful. CBD is generally safe and it rarely causes dangerous side effects. See my other videos on CBD for more information about the mood-altering benefits of CBD supplementation. Though the amino acid taurine doesn't directly target serotonin production, it's still worth noting that it has inhibitory effects, and these may reduce racing thoughts that are associated with anxiety disorders such as obsessive compulsive disorder. Doses can be up to 1 gram taken 3 times per day. Inositol, or more precisely myoinositol, is a carbocyclic sugar, and it's abundant in the brain and other mammalian tissues. It mediates cell signal transduction in response to a variety of hormones, neurotransmitters, and growth factors, and it participates in osmoregulation. It plays a role in how neurotransmitters work in the brain and throughout the body, including the reversal of desensitization of serotonin receptors, and as such, inositol may have beneficial effects on anxiety and obsessive compulsive disorder similar to serotonin uptake inhibitors. Doses can range from 2 to 4 grams per day. Like most physical and neurological imbalances, a lack of sleep is implicated. Improving sleep, therefore, can have a great benefit to a wide range of conditions. Alterations in the circadian secretion of melatonin have been reported in obsessive compulsive disorder. In medication-free individuals with obsessive compulsive disorder, the nighttime peak of melatonin concentrations was shown to be markedly reduced in comparison to control subjects. An individual's dose of melatonin can vary greatly, therefore it can take trial and error, slowly titrating up over time to determine the optimal dose for an individual. Other methods of improving the circadian day-night body clock can be reducing caffeine and sugar, removing electronic devices from your bedroom, using blue light blocking glasses, waking up when it's bright and going to sleep when it's dark. Be sure to check out my other videos on herbs and supplements that help to promote a proper sleep, my video on melatonin, and check out my video on schizophrenia, as similar brain mechanisms may be involved. For more information about the herbs or supplements mentioned in this presentation, check out my website.